Lanka Hospital's ultra-chic Women's Wellness Center is an internationally benchmarked diagnostic and treatment center for women, offering a wide range of holistic screening packages tailored to meet the needs of women in various stages of life. This one-stop center, encompassing many important medical services and facilities for girls and women from puberty through menopause, is modeled to mimic women's wellness centers in the developed world and to be on par with international healthcare standards. Lanka Hospital's Women's Wellness Center is unique in its ability to ensure privacy and in providing swift, efficient and cost-effective treatment under one roof for female patients suffering from various health conditions. A comprehensive range of women's wellness packages is now available at Lanka Hospitals, including routine well-woman care, pap smear, breast screening, treatment for prepubertal and issues regarding menarche, menstrual disorders, benign and malignant breast issues, prenatal, delivery and postnatal care, treatment for gynecological malignancies, family planning, breastfeeding issues, women's psychological care, premenopausal and postmenopausal care, treatment for female urinary incontinence, sexual function disorder, gynecological cosmetic surgery, premarital counseling, health education, parent crafting, and for the first time in Sri Lanka, a breast cancer family history clinic. The Women's Wellness Center of Lanka Hospitals also houses the latest state-of-the-art digital mammogram machinery, ensuring minimal discomfort and lowest radiation to patients. The latest of its kind, Fujifilm Amulet Inability, has the highest sensitivity to detect breast cancer at a very early stage, while having the capability of performing breast biopsies and localized procedures. With state-of-the-art detection, therapy and well-known specialists on call, those not only afflicted by breast cancer, but females affected by any medical condition can be treated in comfort and with efficiency at this facility. The multi-award-winning internationally accredited Lanka Hospitals PLC is poised to deliver maximum patient safety and superior care in compliance with the Joint Commission International Accreditation it is honored with.
Good afternoon. A warm welcome to all of you who have joined us for this webinar on what you should know about breast cancer. I am Dr. Kanchana Wijesinghe, Head of Women's Wellness Center at Lanka Hospitals, Colombo. As you are all aware, breast cancer is the commonest cancer among females globally and here in Sri Lanka as well. It is timely that we educate all our ladies about etiology, signs and symptoms, treatment modalities, etc. so they can be more vigilant and proactive about it and use the available screening resources. We just concluded a month of October, a month dedicated for breast cancer awareness, which is commemorated worldwide. We give so much emphasis on raising breast cancer awareness because early detection and prompt treatment at the inception can lead to marked reduction in mortality, and the survivors can be of a better quality of life. Early treatment would result in greater possibility of conservative breast surgery, preservation of body image, less aggressive treatment, and then finally a better outcome. So keeping all that in mind, our mission today from the Wellness Clinic is to join with you from the Airtel team in organizing this webinar, hoping to deliver the message that early detection saves lives. I would like to request all participants to feel free to send any queries to the chat box, and we will be allocating a time after the main lecture for the questions and answer session. Let's move on with the agenda for today. Our eminent speaker today is Dr. Kanchana Wijesinghe, Consultant General Surgeon at Colombo South Teaching Hospital, Senior Lecturer, Department of Surgery, Faculty of Medical Sciences, University of Sri Jayawardhanapura, and is also a visiting consultant at Lanka Hospitals, Colombo. I now invite Dr. Kanchana Wijesinghe to address our participants. Over to you, Dr. Kanchana.
Thank you, Chamindi. I hope all of you can hear me and see our presentation. So thank you all for joining today for a very good cause, that is to know about breast cancer. And as Chamindi said, I think it is very timely, not only females, males, all of us know about breast cancer. And at the end of this session, there are a few key messages that I want you to, few key messages that I want you all to be taking home. And the most important message that I want all of you to take home is that although breast cancer is so prevalent, early detection is the key, the way we can defeat it. So we all know October month was dedicated for breast cancer. And the slogan I want you, all of you to remember is mother, daughter, friend or wife, make early detection a habit for life. So make it a habit from today on. Okay. So how well do you know about breast cancer? You see, not only doctors, it is very important for you to know about your health. And how well do you know about breast cancer, and why should you know about breast cancer? Now, do you know that it is the commonest cancer among females in Sri Lanka? Right? So if you take all the cancers that females get, breast cancer tops. And approximately now, although this says 3,000, now the current data says around 4,000 new cases are diagnosed each year in Sri Lanka. So that's a big amount. And unfortunately, majority of these patients present a little late when 100% treatment cannot be guaranteed. Right? And this is one of the leading causes of cancer-related deaths in Sri Lanka. So let's see. So one way that we can beat breast cancer is via early detection. Okay. Right. So one key way all of us can beat breast cancer is by early detection. That can be done at your level, right? So what can you do? Now, if you take if you look at this crowd, some women in this crowd enjoying, I think it's a fair, are having early detection without their knowledge. Same way among you, there are some females having breast cancer without their knowledge at a very early stage. Now let's see how we can capture these people. Just concentrate on the picture in the right side, okay? The stages of breast cancer. Now, if you look at breast cancer, we categorize breast cancer from 0 to 4. 0 is the stage where breast cancers are just about to start. But if you look at a small lesion is now cropping up, right? And then when it comes to stage 2, it is now slowly spreading into the armpit and so on and so forth. And by the stage 4, it has spread to the whole body. Now, just look at the survival rate at bottom. In stage 0 and 1, the survival is almost 100%. So don't you think it would be great if we can capture our females or identify our females developing breast cancer at this stage, 0 and 1? Then we can actually guarantee 100%, almost 100% cure. But if you look at 2, 3, 4, the survival is dropping because now the breast cancer has spread. Now in Sri Lanka, a majority of the patients present at stage 2. So let's try to change it. Let's try to get our females presenting at 0 and 1. Now let's see how to do this. So early detection is what will save the lives from breast cancer. The first and the most basic form that we say is self-breast examination. Now that is for all the females, irrespective of their age, especially after 25 years of age. So what we recommend as surgeons, all medical professionals, what we recommend is, let's say, take a fixed date per month. The usual recommended date is about 7 days after menses or periods, because close to menses or periods, the breasts are very tender. So that's not a good time to examine your breasts. Pick a date about 7 days after menses. This takes about 2-3 minutes. Go in front of a mirror. Good time is when you're taking a wash and examine your breast. First see, and then examine your breast with your, just if you can see, take 3 fingers and with firm palpation, firm pressure, examine the breast. Do it in a methodical way. Either go round and round or go up and down. Right? Don't just press here and there. And the importance of doing this is you will identify what is normal for you. When you know what is normal for you, immediately you will notice a difference at a very early stage. And that is the time if you see a difference, if you feel a change in the texture, or there is a nipple discharge or an unusual pain, then you know, okay, this is different. I need to go and get a checkup. Go and get a checkup done. So that is what we advocate for all females, okay, irrespective of their age. If you look at the right-hand corner, we recommend annual mammograms or mammograms at least once in 2 years for females above 40 or 45. Now, there is no exact cutoff. Now, if you take America, in America, they recommend for more than 40 years, whereas in UK, they recommend above 47 years, right? But we generally in Sri Lanka recommend after 45 years of age to go ahead with the annual mammogram at least once in 2 years. Now, unfortunately, we don't have screening mammogram facilities in the government sector, like in other Western countries. But still, we don't have to sit and sulk. I think do your self-breast examination, and if you're above 45 years, it is a good investment to start going ahead and getting a screening mammogram done. If you feel like there is any abnormality, go ahead to one of your local breast clinics and get a checkup done. So you have options available to identify breast cancer or any abnormality, right, to get treated. So as I told you, remember 0 and 1 stage are the best stages to identify a breast cancer. Only a screening mammogram will be able to identify these, because these are not actually felt. So you won't feel a 0 cancer. You will not feel a cancer when it's in stage 1. Only a screening mammogram will be able to say, look, there is some abnormality and you need to get checked up. So that is why in other Western countries, they freely give the screening mammogram facilities for females. But I think it is a good for you all also to read up and consider if you're above 45 years to go ahead with a screening mammogram. So that is one thing. Try to encourage, if you have female friends, if you have relations, mothers or daughters or sisters, encourage to go ahead with self-breast examination and screening mammogram to detect a cancer early if they are developing, right? That's the first key message. And the second key message I want to give you all is, okay, so let's say we all know 1 in 8 females are at risk of developing breast cancer. That means you and I, irrespective of our profession or whatever we do, we are at risk. Now, can we modify some of these risks to reduce the chance of getting breast cancer? So if you look at this chart, there are some modifiable risk factors. So why not we modify them, especially body weight? Try to keep it at a optimum BMI range. The more we have body fat, more estrogen hormone is produced, and that triggers production, mutation of cells causing breast cancer. So let's try to maintain an ideal body weight. Physical activity is supposed to be a very good protective factor to fight against breast cancer, right? So limit alcohol use also. Smoking, I would say stop smoking, because that is very precancerous, right? And what about the use of hormones? Some of us, especially after menopause, get very bad symptoms, difficult time with hot flushes, sweating, a lot of difficulties during menopause, and we try to resort to hormones. Limit the use of hormones as much as possible, because hormones is a very big risk factor to develop breast cancer. And of course, pregnancy and breastfeeding are very good protective factors. So if you are having children, try to breastfeed for some time, at least a year, so that it's a very good protective factor. Radiation exposure is if you had a history of being treated for any other condition with radiation, right? So try to limit all those things. Now, so these are some of the modifiable risk factors that we can change to avert or prevent getting breast cancer. So that's the second message, right? Go for a good run, do some activities, maintain a good BMI, avoid all these unnecessary smoking and alcohol, right? These are some of the things you can do at your stage to modify your risk, right? Now, the third one is something that is, let's say now somebody's been diagnosed with a breast cancer. Just it's unfortunate circumstance. Let's see what we have to do. Now, assume you're doing your self-breast examination and you found something abnormal, a vague thickening or a lump or a discharge. Don't wait and be your own doctor, or don't ask your relations or colleagues for advice. Please go and get some proper advice from a medical professional, because it might be a cancer. So better go and ensure that this is not a cancer, right? So some of the warning signs, so these are all patients who have presented to our clinics. If you see a change in this breast shape, now of course some of these patients are in very advanced stage. Can you see here there is a the skin is sinking inside, right? So that is also another odd change so there is a breast cancer underneath. So any skin changes, a lump, nipple discharge, make sure that you go ahead and get yourself checked. So if you have some abnormality, what happens is the doctor will examine you and then tell, okay, now let's go ahead with some investigations. So depending on the condition and your age, we will perform an ultrasound scan and a mammogram, right, to confirm a diagnosis. So both of these tests, you don't have to worry, very minimal discomfort. And in today's day and age, we have very good facilities to provide very good ultrasound scan and mammograms, right? So that is, so they check, it's an imaging investigation. Once that is done, now if there is a lump, what happens is we will want to confirm what is actually in the cells. So we will take a small sample from this lesion to see whether this has cancer cells or it is actually a harmless lesion, right? So there are three things. So the doctor will examine you, then you will be told to get some investigations like a scan and a mammogram, and then we will take some cell samples to confirm a diagnosis. That is the usual way a breast lump or a breast, any complaint is assessed, right? Sorry. So the key messages I wanted to give you was, remember, early detection is the way. Second one is, let's modify our risk factors. And thirdly, if you have a lesion, what will happen, right? The fourth one is something just for you to know, because if you have somebody with breast cancer who's having a lump, who is reluctant to go for treatment, maybe your knowledge might help encourage for that person to go and seek medical help, because nowadays the medical is so advanced that we can give the best treatment for the patient, right? Now, if you look in treatment of breast cancer, we have two arms, right? The local and the systemic. Just to clarify it, now let's say a patient has a breast cancer, somebody, right? Somebody is having a breast cancer, so there are cancer cells in the breast. So that's the local problem. Then we all know these cancer cells have the ability to go to the body, right? So you might have spoken like, you know, the cancer has spread to the body or in a very advanced stage. So that is, the cancer cells have gone through the bloodstream into the liver or the bone, or has gone into the body. So there are two things in our management. One is we have to treat the breast cancer in breast. And the second one is we have to treat all the cancer cells that have gotten into the body, right? So we have the local treatment and the systemic treatment, right? Just a little bit for you also to know. It's good to know. It's always good to know about these. So in local treatment of breast cancer, we discuss about surgery, right? So when you have a cancer in the breast, we have to remove that cancer. That is called surgery. Now, the traditional thinking was and sometimes is that we have to remove the entire breast. And I have actually come across some patients who have been reluctant to come to the clinic purely because they were afraid now the breast will be completely removed, and they just didn't want to go through that, right? Because imagine having your one breast entirely removed. So nowadays we don't do that. Now, if you look at this picture, will you believe me when I tell you that this patient has undergone a breast surgery for breast cancer? It is hardly visible. She came with an extensive cancer, and we have done a surgery to make you believe. I am showing you this. You will see this small incision here, the red line, right? So we have removed the entire breast tissue around this area and refilled with the patient's own fat, right? And look at the outcome, right? So if you have friends or colleagues afraid, tell there are these options available now and not to worry, right? So I'm going to show you some similar pictures where breast reconstruction and reformation has been done in breast cancer patients. Now, if you look at this picture, this patient had two problems. She had massive breast, which is called macromastia. She was suffering from that, and she also came with the breast cancer. So we took the opportunity to reduce her breast and get rid of the breast cancer as well. So what I'm trying to say is, nowadays we don't do surgery like this. We hardly see females ending up with a total breast removed and the swelling of the hand because of the surgical complication, right? We try our best to do the minimum, the best, and to eradicate the whole breast cancer from the breast, right? So that's about, so now let's say we have removed the entire cancer from the breast, and we have now nicely reformed the breast, but still we are not going to sit and say that is it. Maybe we have missed one or two cells in the breast. So we just don't want to leave it there. Radiotherapy then comes to our rescue. So what radiotherapy does is high dose X-rays targeted at the breast to destroy any more cancer cells in the breast. So with the surgery and the radiotherapy, we try our best to remove all the cancer cells from the breast. Okay, right. Then, of course, I told you there are some cancer cells. These are very notorious cancer cells. They will go into the body. So we have to attack these cells and destroy them. Otherwise, the cancer will come from where they have gone into, right? So we have different forms of treatment. We call chemotherapy, hormone therapy. I'm not going into detail. What I want you to know is you have to, if your doctor is recommending them to you, you have to undergo these treatment, because they will destroy any cancer cells in the body, right? So at the end of the treatment, so the whole treatment course will take about good 8 to 9 months, but it is worth it, because once you have gotten your treatment, then you are almost free of your cancer. And then you have to be vigilant and take what the doctor will advise you to be seen regularly and follow that. If you do a half-hearted job, like only the surgery and neglect the rest of the treatment, of course, the cancer is going to come back, right? So if you have any friends who are going through this, please encourage them to take the full treatment, right? So last, I have, now this is a question, this is just, I put this slide. So if you have any ideas or you have questions, it's a good time for you to now let us know through chat, anything, right? So whenever I see a patient, I say, let me know anything you want to ask me, right? And sometimes I learn from my patients, from you all as well, right? So little bit about some common myths that we have. Some females think if I don't have a family history, I won't get it, right? And they think my mother doesn't have, my grandmother doesn't have, so I won't get it. But let me tell you, 70 to 80% of patients who come with breast cancer have no family history. So you are also at risk. Again, I told you, I encourage you to maintain a healthy weight, exercise regularly, right? All these things are very good anyway for your health. But remember, this will only lower your risk, right? It won't eliminate. So make sure you do your self-breast examination and a screening mammogram if possible, right? And another one is breast cancer only happens at the age of, after 50, 60. We try to, reassure ourselves we are still young. But let me tell you, the youngest female that I have treated was 26 years old, right? So young women can get breast cancer. So be on the alert. Not to be scared, just do your self-breast examination. And if you're above 40 or 45, go ahead with a screening if possible. What about men? Men also get breast cancer. So if males, if you feel anything, abnormal in that area, make sure to get a checkup. Can a mammogram cause cancer? No, it's a very low dose X-ray. Some females are afraid, why should we be exposed to mammogram once in 2 years? Let me tell you, the benefits are more. That is why it is so promoted in the Western developed countries, right? And last but not least, I think it's the last myth I want to say. Some people are worried that we will completely remove the breast and just leave it as that. No, today we don't do that. We have a lot of surgical options. Even if we remove the breast, we will make sure that we reform so that the patient will be able to go back into her normal life and feel normal at the end of all the treatment. So if you have somebody who has breast cancer and is very upset and is thinking it's her fault, tell her it's not her fault, right? There is a risk with everything in life, and don't beat yourself. Just face the treatment and let's go through it, right? So finally, the key messages, as I told you at the very beginning, is I hope you have learned something from this. If at all, remember, the only thing I want you to take home is that it is important for us to go ahead with early detection. So if you understand the importance of early detection, remember, detect early, less surgery, less extensive treatment, and 100% survival. That is what you want to happen to your sister, mother, daughter, relative, or friend. So go and, now I have given you a small lecture today. Go and educate your friends, colleagues also, anybody that you know, right? Thank you very much. Just final comment. Remember, when someone has cancer, it is not only the patient, the whole family and everyone who loves them does too. So let's beat breast cancer. Thank you very much.
Thank you, Dr. Kanchana Wijesinghe, for that excellent presentation, comprehensively covering all aspects of breast cancer, starting from the modalities of early detection, risk factors, signs, symptoms, diagnosis, and treatment. We will now move on to the question and answer session. If there's anyone who wants to raise any questions, feel free to do that now. Yes.
Shara, yes, Shara. So it's a good question actually. Now, it depends on what type of a family history it is. So if you have a mother or a sister who has had breast cancer at the age of 40 or less, or let's say less than 45, that is quite significant. But of course, if you have a mother or a grandmother who has had a family history, let's say at the breast cancer at the age of 70 or 80, then the risk is less. So what my suggestion is, I think it's best to go and get a checkup with a doctor, because the doctor will be able to assess your family history and see how significant that is. If it is very significant, you need to be closely followed up. But regardless, once you are above 40, you have to be anyway vigilant. So as I said, 40 to 45, better start getting your screening mammogram done at least once in 2 years. Right? Because in America, for all females, regardless of family history, they recommend it above 40. So we generally say above 45 years for Sri Lanka. Thank you.
Does IVF increase the risk factor?
Yes, it's like this. So when you're being done these procedures, hormones are injected into the body for a short period of time. So that is also important. If you're going through IVF, I think that is very important for you to adhere to that and continue that treatment. Of course, you are being given externally hormones, right? So there is a slight increase in the risk if you are being subjected to IVF during that time, right? It's a slight increase. So my advice is, if you are getting IVF treatment, why not also be vigilant about developing a cancer? It's a very slight increase. Let's say if you're obese, you're having a redundant life, not exercising at all, eating all the fatty food, you have an equal risk as IVF, you understand? So they don't worry about it. Just do your self-breast examination and go ahead with the screening, especially if you had some hormone treatment. Thank you.
The next question is, are there any vaccines to minimize the risk of breast cancers like there is for cervical cancer?
Unfortunately not. That is the biggest problem with breast cancer. So we don't have vaccines, right? So the only way we can beat it is, as I said, is via early detection at the earliest possible stage. So for example, a screening mammogram can catch cells even before they have changed to cancer. They will say these cells are going to change to cancer. So we can address then and there, right? So no vaccines, early detection is the key.
Is there any more questions? Kindly feel free to, yeah.
Well, there's another question from Tanuja. Are there tests for below 40 years? So for now, below 40 years, the risk of developing cancer is a little less, and also the breasts are very dense. The young breast is quite dense. So it is very difficult for a mammogram to catch a lesion below 40 years. So that is why below 40 years, we don't generally recommend a mammogram. So the advice is to do self-breast examination once a month. And if you feel any abnormality, go and get a checkup. Because if there is anything that the doctor can catch, then the doctor feels there's something wrong, we can go ahead with the ultrasound scan of the breast. Ultrasound scan is a very good option for females below 40.
That's all the questions they have asked for now.
There is one more question, Chamindi. I'll quickly answer that.
Yes.
Is there a link between mental stress and the risk of getting breast cancer? Yes, stress has been linked to causing not only breast cancer, it's related to a lot of other problems, even diabetes, hypertension. Stress can lead to physical inactivity, sedentary lifestyle, all these, yes, there is a risk. So anyway, I think stress is not a good thing. If you are feeling stressed and burnt out, it's always a good option to go and have a chat with somebody. There are counselors, support groups, have a chat and see about it. Thank you.
I would like to take this opportunity to introduce the services provided by the Women's Wellness Center at Lanka Hospitals. It's an exclusive center dedicated for women of all age groups, from puberty to menopause. The center features country's best and renowned gynecologists and also renowned surgeons. The services include routine well-woman care, cancer screening services, gynecological services, pre- and postnatal checkups, psychological support, and sexually health services. The center is equipped with the ultra-modern equipment, including the latest state-of-art Fujifilm mammogram, which ensures minimal discomfort and lowest radiation. We have arranged a special discount scheme for all the Airtel staff and their family members, which allows discounts on mammograms and ultrasound breast and breast screening packages. You can book your appointments through the dedicated hotline mentioned in the flyer. We are at the end of this session, and there are some more questions.
Yes, I was just typing some answers,
Okay.
Chamindi.
Yes,
I just answered that there are no blood tests to detect breast cancer at the moment, a good one with high sensitivity and specificity. One last question we have, what is the role of chemotherapy and are there any side effects from chemotherapy? Now the role of chemotherapy, as I said, is chemotherapy is given to attack cancer cells in the body, right? So if there are cancer cells now, say breast cancer cells that have gotten into the body, so we need to destroy them. Otherwise, if they, let's say some cancer cells are in the bone or the liver, they won't just stay there, they will grow. Problem with cancer cells is they continue to multiply. So they will grow and destroy those structures. So the role of the chemotherapy is to destroy all these cancer cells that have gotten into the body. Idea is to stop the cancer from coming back and destroy all these cancer cells. Side effects, yes, everything in life has pros and cons. So there are side effects of chemotherapy, but the benefit outweighs more, right? So don't only concentrate on the side effects. You might lose your hair for a short period of time. You might have body aches and pains and fatigue, etc. during this period, but it is done for a good reason, to destroy cancer cells in your body. So if your doctor is recommending it, your breast surgeon or your oncosurgeon or your oncologist is recommending, go ahead with the treatment. And side effects are for a short period of time, but then your survival is for your whole lifetime, right? Thank you.
Yeah, at the end of this session, first and foremost, I would like to thank the management of Lanka Hospitals for giving us this opportunity to conduct this program. My heartfelt gratitude goes to Dr. Kanchana Wijesinghe for dedicating her valuable time to be with us today. I'm hoping all the ladies in our audience have taken the key take-home message, the importance of screening, and the message that early detection saves lives. I would like to thank Ms. Tanuja Suryarachi and the Airtel team for partnering with us and giving us the opportunity to raise awareness among your staff and their families. Last but not the least, to the marketing team of Lanka Hospitals who made it happen. Thank you for joining us and have a pleasant evening.